How do you as a surgeon prepare for my rhinoplasty? There's a lot involved. At my initial consultation, I assess you for your candidacy. Is this a patient whose life would be improved by addressing something in their nose, a hump, some asymmetry, a big bulbous tip? I want to know what the patient's dream nose is. I tell them, if I was the nose wizard, what would you like your nose to look like? I want to understand their objectives, but I'm not the nose wizard. There is no nose wizard. I can push the nose a whole lot in the right direction, and my job is to see if they're willing to accept the constraints of what's achievable. We have to evaluate the function of the nose. We ask about allergies, prior trauma, fractures, and stuff like that, because sometimes that can be improved by working on the septum or the turbinates. Some patients have already done a lot of internet research, and there's about 2/3 good information on the internet, about 1/3 not so good that can be misleading. And some patients do a lot of research and really want to know a lot about the details of the procedure. Other patients want to be spared that, so you have to kind of assess the patient in terms of how you can help them best. The morning of the operating room, what I typically do is at the beginning of the case, I'm with the patient the whole time, holding their hand and talking to them and stuff. We've already gotten all the instructions out of the way and they're all prepared for the procedure. But what I do is we sedate the patient then, and then we do injections to numb the nose, so that once the nose is numb, we're not hurting or stimulating the patient, so we can back off on the sedation. We inject adrenaline or epinephrine, and what that does, the nose bleeds a lot, and so what the epinephrine does is it vasoconstricts and cuts down on bleeding. You can start right away, but it's better to wait about 10 or 15 minutes to allow that to really kick in and not be in a rush, because the patient will have less bleeding and bruising as a result of that. The procedure is easier to perform if you wait until the vasoconstriction is optimized so you can see what's going on. And during that time, I reanalyze the pictures. I make a list of all the issues of the nose, and then I probably write down 7 to 10 steps that I anticipate taking. I come in with a real solid plan, but then once you begin the surgery, sometimes some adaptation is required. A rhinoplasty is like the Super Bowl. You're experienced, you belong there. You've played against the other players. You know what the other coaches are thinking. You know what their injuries are. But as much as you plan for the Super Bowl, if you get 2 touchdowns ahead or 2 touchdowns behind, or if one of the quarterbacks sprains his ankle, then you have to be able to adapt. And rhinoplasty is like that. Sometimes you can sand down a hump on a relatively straight nose, but now the leading edge of the dorsum is deviated one way a little bit or another, and you have to be able to adapt to that.